We're talking about the crisis of homelessness. For years, California has grappled with tent cities, skyrocketing costs, and policies that seem to yield little fruit. The state has invested billions, a number so large it loses meaning, yet the problem only seems to metastasize. Can a place this rich, this resourceful, truly be defeated by homelessness? Or is it simply failing to try the right things? We're peeling back the veneer of incremental policy to ask the uncomfortable question: will California's current strategy ever end homelessness, or are radical, paradigm-shattering solutions the only path forward? California's shame, the scale of the crisis. The reality of California's homelessness crisis is less a problem and more a humanitarian disaster unfolding in plain sight, dwarfing the scale of virtually every other state. The latest federal data estimates that California is home to over 511,399 people experiencing homelessness on any given night, representing nearly a quarter of the entire unhoused population in the United States. This staggering number alone makes it one of the highest per capita rates in the nation. Perhaps the most shocking statistic is that two-thirds of this population, or over 350,000 individuals, are unsheltered, meaning they are sleeping outdoors in tents, cars, or on the streets. This is nearly half of the entire nation's unsheltered population, a grim distinction that highlights California's unique failure to provide basic shelter. Furthermore, the crisis is relentless, with the state's homeless population growing by over 20% between 2019 and 2024, despite massive financial intervention. The problem isn't static, it's a rapidly expanding tragedy that pushes critical social services to their breaking point, strains public infrastructure, and creates dangerous and unsanitary conditions, including a dramatic increase in homeless-related fires in major cities like Los Angeles. The visible encampments have become a global symbol of the state's severe wealth inequality and its inability to secure the most basic human need, shelter. The $24 billion question: where has the money gone? The public's central question remains: how could this crisis continue to worsen when California has invested an estimated $24 billion in homelessness programs over the 5 fiscal years leading up to 2024? This colossal sum was intended to fund a sprawling network of over 30 different state-administered programs, ranging from permanent housing construction to immediate shelter grants. Yet the overall homeless population has continued to climb, raising serious alarms about the effectiveness and, critically, the accountability of this spending. A 2024 state audit delivered a harsh indictment, finding that the state's primary coordinating body failed to consistently track and evaluate the outcomes of these programs since 2021. In essence, the state has been operating in a data desert, unable to conclusively determine which programs are cost-effective and which are simply consuming taxpayer money without tangible results. The audit noted that only a couple of initiatives, like the program converting hotels and motels into housing, Project HomeKey, were demonstrably likely cost-effective. This lack of financial oversight and outcomes-based reporting is a fundamental structural flaw. While $24 billion sounds like a solution, it's clear that the money hasn't been spent strategically or tracked rigorously, leading to public cynicism and providing insufficient assurance that future billions will yield a different result. The state's response has been to promise greater accountability, but critics argue that without a fundamental policy shift, this massive spending is simply subsidizing failure. Housing first. What is California's core policy? The foundation of California's official strategy for tackling homelessness is the Housing First model. This is an evidence-based approach that prioritizes providing safe, permanent housing immediately without imposing preconditions like mandated sobriety, employment, or participation in mental health treatment. The core philosophy is straightforward. A stable home is a fundamental human need and a necessary precursor for an individual to address their underlying challenges, such as chronic addiction or mental illness. The policy is codified into state law and dictates how billions in funding are distributed to local continuums of care. Advocates champion housing first as a necessary, humane approach that ends the perpetual cycle of evicting people from shelters due to substance use, only for them to return to the streets. However, critics point to the model's implementation in California as a major source of the crisis stagnation. They argue that housing first, as currently practiced, often translates to housing only, where the supportive services that are supposed to accompany the housing, case management, addiction counseling, and medical care, are either underfunded, poorly integrated, or simply not utilized by residents who are not mandated to accept them. For individuals with severe mental health or substance abuse issues, simply handing them an apartment without requiring engagement in treatment has not led to the community stabilization or personal recovery that was promised, contributing to the persistent visibility and public disorder associated with the crisis.
The invisible crisis: the rise of homeless families and seniors. While the image of homelessness is often a single, chronically unhoused adult, a more subtle and alarming facet of the crisis is the rapidly growing population of vulnerable seniors and families with children. Data from the 2024 point-in-time counts show that roughly 40% of homeless adults in California are aged 50 or older, a demographic whose numbers are surging due to fixed incomes being swallowed by the state's high cost of living. For these older adults, housing loss is often a one-way ticket, as they lack the earning potential to re-enter the housing market. They are more vulnerable to health issues and often require supportive services that are complex and long-term. Even more concerning is the situation for children. In the 2022-2023 school year, over 230,000 public school students in California were identified as experiencing homelessness, a number that underscores the economic instability afflicting even working poor households. While this group constitutes around 14% of the overall homeless population, their vulnerability is extreme. These families and seniors are the casualties of a sheer lack of affordable housing, not necessarily addiction or mental illness. For them, a system focused heavily on chronic, unsheltered individuals often misses the mark, requiring interventions like rental assistance and affordable housing development that prevent their initial slide into poverty, which is a fundamentally different approach than providing permanent supportive housing for complex cases. The rise of these groups reveals that California's problem is as much about poverty and housing supply as it is about behavioral health. The cost trap. Why does CA housing cost $750,000 per unit? One of the most profound and frustrating paradoxes of California's approach to homelessness is the exorbitant cost of building new permanent supportive housing units, which are often cited as the ultimate solution under the Housing First model. The capital costs for new PSH construction in California's major urban centers frequently hover above $600,000 per unit, and in some notorious cases have soared to over $750,000 per unit. To put this into perspective, for the cost of building one modest studio apartment for a formerly unhoused individual, one could often buy a luxury condo or a detached single-family home in many other parts of the country. The question is, why? A confluence of factors creates this cost trap. Excessive regulatory red tape and local opposition, NIMBY-ism, inflate timelines, forcing developers to hold expensive financing for longer periods. California's prevailing wage laws, which mandate higher than average wages for construction labor, add to the price tag. Furthermore, the specialized nature of permanent supportive housing requires integrating medical and administrative offices, community spaces, and on-site service rooms, which complicates the design and construction process, pushing costs well beyond that of standard affordable housing. This enormous per-unit cost has a crippling effect on the ability to scale solutions. The state can only build a fraction of the units needed to house its massive, unsheltered population. This financial bottleneck is perhaps the strongest argument against the current strategy, leading critics to suggest that the state must abandon its reliance on complex, expensive, stick-built PSH and urgently pivot to faster, cheaper, manufactured housing alternatives if it ever hopes to house tens of thousands of people effectively. The current economic model is unsustainable, creating an unbridgeable gap between the need and the solution. Unconditional cash. Is guaranteed income the key? As traditional housing and service models struggle, a radical, simple concept is gaining traction: giving unconditional cash directly to people experiencing homelessness. The idea is a form of guaranteed income or miracle money, based on the principle that the unhoused are capable of managing their own finances, and that a lack of income is the primary obstacle to stability. This approach operates outside the bureaucratic, restrictive systems of government aid. Several small-scale randomized controlled trials in California are providing fascinating data. For example, one study gave $750 per month for a year to unhoused participants. Initial results have been highly promising, fundamentally challenging the long-held public myth that cash would be spent primarily on drugs or alcohol. Instead, participants overwhelmingly reported spending the money on essential needs, covering the initial costs of securing an apartment, paying for phone service to look for work, buying food, or maintaining a storage unit. Crucially, the participants who received the Cash Plus social support were significantly less likely to report being unsheltered after 6 months compared to the control group. This approach is effective because it bypasses the massive construction costs of PSH and puts purchasing power and dignity directly into the hands of the individual. It suggests that for many, particularly those new to homelessness, the primary intervention needed is not a $750,000 unit, but the financial cushion required to stabilize a fragile situation. While guaranteed income alone isn't a silver bullet for chronic homelessness involving severe mental illness, the data strongly supports it as an effective, low-cost tool for preventing and quickly resolving situational homelessness. The Exodus effect. Is California a magnet for homelessness? A common and politically charged narrative is that California's mild climate and generous social services act as a magnet, drawing homeless people from other states, thus making it impossible for local policies to succeed. However, this argument is largely refuted by comprehensive demographic data. Multiple large-scale surveys of California's homeless population have consistently found that the vast majority, as high as 90% in some studies, were already living in the state when they lost their housing. Furthermore, roughly 3/4 of the homeless population remain in the same county where they last had a stable residence. The problem is not an influx from without, it is a domestic production crisis, where the state's crushing affordability crisis is converting low-income working-class residents into unhoused individuals at an unprecedented rate. While the state's high rate of unsheltered homelessness, 66%, is certainly influenced by the milder climate, which makes living outdoors survivable year-round, the primary driver of the sheer volume of homelessness is rooted in California's structural economic issues: a critical shortage of affordable housing, decades of inadequate mental health infrastructure, and a cost of living that far outpaces wages. Focusing on a magnet effect distracts from the core solvable issues that lie within California's own borders. The data clearly indicates that the solution must be built within the state, targeting the economic and systemic failures that are forcing its own residents onto the streets.